Hello everyone, welcome to the very first podcast of Medentech. This is Dr. Ayesha and I'm your host for today. With me, we have Dr. Niha Adnan, who is a restorative dentist and a researcher who is working on integrating AI into oral healthcare. Thank you so much, Dr. Niha, for joining us today.
Thank you for having me. I'm very excited to be here and talk about how AI is being integrated into dentistry.
So, Dr. Niha, we all know that AI has been making headlines. AI doctors आ गए हैं, diseases detect हो रहे हैं, self-driving cars आ रहे हैं. But when we talk about dentistry, what exactly is artificial intelligence in relevance to dentistry?
So artificial intelligence is basically teaching a computer how to think like humans, but it's able to do that a lot faster. It's able to see and recognize patterns and learn from it much faster than a human being. So in dentistry, that means, for example, if a dentist is looking at an OPG, and we take 10 minutes to recognize all of the findings in that X-ray, and AI might be able to do it in 2 minutes. So it's a lot more faster, it's precise, it doesn't miss any findings. So that's where AI comes in. It's not replacing dentists, but it's like a second pair of expert eyes for us.
But dentists are already trained for these tasks, right? Then why do we even need AI?
So that's a great question. So dentists aren't really available everywhere, are they? So using AI to detect diseases in areas where dentists are not available helps with accessibility of healthcare in, like, for example, rural areas of Pakistan. Moreover, so AI is very consistent in its results, as dentists are trained differently. Some of us are able to see diseases better than the other, but when an AI is trained to do that job, it's able to be consistent throughout. So it really helps with making the results consistent. And also, because AI is able to learn very small patterns that a human might miss, it's able to catch cavities at a very earlier stage that a human may miss, depending on their expert level.
So that brings me to the big question. Like, are you claiming AI performs better than humans?
So in certain cases, yes. Studies have shown that AI has the ability to detect diseases, for example, cavities, at a very early stage. But it doesn't replace a dentist's judgment. Rather, it just works alongside them. So think of it as a safety net. So we need AI so nothing is overlooked by us.
That's interesting, actually. Can you give us some real-life examples where already AI dentistry may use हो रहा है?
So far we have already worked on it. AI is being used to detect dental decay on intraoral photographs of the oral cavity. We have trained AI to detect all of the findings possible on an OPG X-ray, which is a panoramic X-ray of the entire oral cavity. It's also being used to detect marginal bone loss around dental implants so far. And we're also working on integrating this technology into the field of orthodontics now.
Wow, Dr. Niha, that's progressive. So, is this only for the big fancy hospitals or smaller clinics? इसमें integrate हो सकते हैं?
No, not at all. It's not just for big fancy hospitals. So everything is cloud-based. So even a very small single chair practice can use our services with very low costs.
So, Dr. Niha, my question is, if I'm just a regular patient who's listening to this podcast, how AI can be helpful for me?
So AI can help you with getting faster reports, more precise results. We have also launched this web application called Mere Muskan, where you can just take intraoral pictures and upload them, and our trained AI can detect diseases like dental decay and give you the results and a report immediately.
Dr. Niha, that sounds really innovative, but let's be real. How accurate AI is?
So an AI can only be
I'm sorry to cut off.
Okay.
What are the risks associated with it?
Okay. So when trained on good quality data, AI is able to detect even the smallest of diseases, as we talked about earlier, but it has to be very high quality, annotated data that's annotated by specialists if you want results that are specialist level. So an AI can only be as good as the data that it is trained on. Some of the bad images can throw AI off, which is why we said you need a dentist judgment with it. You just can't rely completely on AI's results. You always need a dentist to verify it.
So, Dr. Niha, that brings me to another interesting question. Can AI ever replace dentists?
No, that's not possible. So dentistry isn't about just detecting disease. Dentistry involves treatment planning. It involves a connection with patients. It involves doing those procedures on the patients. It requires skill that AI so far has not been able to show or display. So no, as of this moment, AI cannot replace a dentist.
So we can say that AI is able to assist the dentist and augment them and not replace, right?
It can be sleep replacement for humans.
And where do you see AI in dentistry in the next decade?
So in the future, I think AI will be everywhere. Any dental x-ray that's taken, it's going to be checked by an AI by default. And I think in the future, AI will be able to tell which patients have risk factors for certain diseases like gum disease or dental decay. So you'll be able to prevent that disease before it even happens. So I think in the future, due to AI, it's going to be more proactive rather than reactive, and dentistry is going to change.
That is awesome, Dr. Niha. Thank you so much. You made it really easy for us to understand.
Thank you. It was my pleasure.
If anything, I want the listeners to take away one thing from this conversation is that AI isn't here to replace dentists, but is just here to make dental disease detection more accurate, more precise, and to make dental care more accessible for everyone.
Perfectly said. And to all your listeners, keep smiling and do not miss your dental checkups.